Today's topic is the Meth Coordinator. Before we begin, I'd like to let you know that this webinar is being recorded. By joining this event, you are automatically consenting to such a recording. If you do not consent, please disconnect from the webinar at this time. During today's webinar, questions can be asked throughout the presentation using the on-screen Q&A system. Simply type your question into the Q&A box, and our moderator will ask the panelists your questions. For questions that are not answered during the presentation, an email addressing outstanding questions will be sent to all the participants, so we'll make sure that we're getting everyone's questions answered. If you need any technical assistance at any time during the call, please press 0 to speak to the operator, or you can also type your question into the chat box so that you can have direct technical assistance online. I would like now to introduce today's moderator, Crystal Owen. She's been Tribal Meth Coordinator since 2007. Crystal is also the host of a weekly talk show on tribal radio station KXSW called Getting Real About Life on the Res, where she promotes healthy conversations to empower her community in the battle against methamphetamine, other drugs, and alcohol. Now I'd like to turn it over to Crystal, and thank you all for participating. Crystal?
Mitakuyapi, my relatives, Tante Washte Nape Chiuzapi. I greet all of you with a good heart and a warm handshake. Today I am joined by two Meth Coordinator colleagues, Leslie St. Clair and Lynn Soderquist. Leslie is a member of the Shoshone-Bannock and has been employed at the Fort Hall Police Department in Idaho since 2005. In addition to serving as a meth coordinator, she is also the sex offender registry technician, and she administers the Enforcing Underage Drinking Laws mini grant funded by the State of Idaho Juvenile Justice Commission. Lynn has been the tribal meth coordinator for the Kalispell Tribal Police Department in Washington State for the last 6 years. Lynn was employed for 25 years as a sales and marketing manager in a telecommunications business until one of her family members became involved with methamphetamine. Lynn made a decision to leave her employment and to get involved as a volunteer in a local community meth watch coalition. Since then, Lynn has worked with grassroots coalitions and community groups, as well as a local county sheriff's department as a communications officer. Welcome, Leslie and Lynn. Before we get started, I would like to remind our audience to submit their questions to our panelists using the screen Q&A system at any time. So to begin, can each of you, Leslie and Lynn, will share a bit of background about your community to kind of give us a picture of where you are from. Lynn, we can start with you.
Thank you, Crystal. Yeah, the Kalispell Tribe of Indians has a really unique scenario, kind of a poverty to prosperity story. But the real unique thing about their reservation and geography is that they are in two separate counties. The north site, which is in the north Washington area, close to the Idaho border in the Ponderay County, is the reservation. And in that area, they're home to 200 of 400 enrolled Kalispell tribal members. The south site, which is in Spokane County, is about 290 acres, and it's 60 miles from the primary reservation. In that location, there is a casino and a hotel. It's about 10 years old, has populations fluctuating up to 7,000 people at any given time. So the vision that the leadership had to move their tribe from poverty into prosperity over the last 10 years has been a wonderful thing for this tribe. And it's included things like a wellness center at the reservation location, which houses a pool center, a workout area, meeting rooms, a medical dental clinic. And also treatment is readily available to any tribal member if they need it.
Hey, thank you, Lynn.
You're
Leslie,
welcome.
what about your community?
We are here, the Shoshone-Bannock tribes in southeast Idaho. We're on the Fort Hall Indian Reservation. We have approximately 544,000 acres of tribal lands. That's, trust land, tribally owned, and tribal member owned. We have about probably around 5,700 tribal members, and our reservation actually spans into 4 different counties here in southeast Idaho. That's Bannock County, Bingham County, Caribou County, and Power County. We have 3 schools located on our reservation. We've got our Shoshone-Bannock Junior Senior High School, which houses kids from 6th grade to 12th. And then we have an elementary school funded by the state. It's a public school, and that goes from kindergarten all the way to 5th grade. And then we've got a charter school that goes from K to 5th grade. And also we just got approved, and we found some funding to start another charter school. So
thank you.
We really push education. Some of the other, I guess, kind of fun facts about Fort Hall is in 2010 we just opened up a brand new justice center, and there's a picture on the slides coming up. That now houses our police staff, all of our law enforcement. It houses our tribal courts, our corrections, and our tribal fish and game departments.
Well, thank you, Leslie, for that update. Both of you, Lynn and Leslie, it sounds as though our communities are similar, and I'm sure for those of you who are listening in on a webinar or have joined us today, in a lot of ways our communities are similar. You know, at our tribe we have 3 casinos, we have 2 schools, things like that. We have a police department that definitely needs to be renovated or even a new one, but a lot of these issues or these how we're made up in Indian country is really very similar. So Leslie and Lynn, as meth prevention coordinators, if you could just share with us a few of some of the main duties that your office handles specifically as a meth coordinator. Lynn, again, we'll start with you.
Some of the things that I've really tried to focus on are relationship building, which means engaging the community in our processes whenever we can. We do that by way of COPS meetings and training events and trying to get out into the community just as regular community members. We also have focused a lot on problem solving, ways to start a discussion about what the community sees as maybe they see that as a problem and we don't, so we start a discussion. We started a feedback process that allows people to anonymously give us feedback, or they can assign their name to it, and then we will then engage with them. One other thing we do is we really think about what can we do to transform what we're doing today, kind of thinking outside the box in order to get people to the table. And we knew originally we really had to have some data, so we started the process of really getting the data together to share that information with the community in order to help them understand that the dangers of methamphetamine and other drugs, and then to invite them into the discussion about what they felt needed to happen.
Good, thank you, Lynn. How about Leslie? What are some of your duties that entail, some of the main duties?
Some of my main duties are, of course, getting out and providing awareness to the community. I do that through, various health fairs that our tribal health department sponsors. Myself and the officers will go into the schools and talk to, the kids about drugs or, not just meth, but drugs and alcohol awareness, and we put stuff out on, our, from time to time we'll do stuff on our Facebook. Just last week we did an event for our local recreation program where, we told the kids about our anonymous tip line, which is like a text line, and so they can text in a tip or something to us anonymously. So we told the kids about that, and then we had our officers do like firearm safety with them. and they got to shoot some pellet guns. So,
wow, sounds like the two of you have been really busy. And I think when we talk about one of the things that stands out is the awareness, problem solving, getting the community involved in community policing, and creating that environment where we work with our tribal police officers and our those who are in different counties from us, the sheriff's office. And so it does involve many different obstacles sometimes that we're facing, great challenges, to be meth prevention coordinators. I think in this at this part of the conversation, I'd like to hear, Lynn, first from you. What do you think are some of the greatest challenges? I know all the good things that you told us that you're doing, but through some of these, what are some of the challenges that, as a meth prevention coordinator, what are some that you face?
I think personally,
or even do you ever feel perhaps feel in danger when speaking out against meth in your community?
I definitely have not ever felt endangered. I've felt empowered for most of my life, so I haven't felt endangered. But I have encountered, there have been certain obstacles, I would say. As a civilian employee in law enforcement, it really means that your leadership team has to see you as a viable part of the team, and so there's a commitment that comes from the top down to your position and the duties that it entails to be at the table and at the discussion when the police department gathers. And I think that is perhaps we're learning how to do that, and every day it gets better, but that's a process that has continues to be addressed.
Thank you. How about you, Leslie? What are some of the challenges that you've faced?
The main thing that I've encountered as the biggest challenge is getting our people to recognize that it's a problem. There is other drugs being used out here on our reservation, and there's alcoholism, but with meth, then I think people kind of didn't think it was that serious, and so my biggest challenge has been getting people to recognize that there is a problem and how dangerous it can be. And other than that, then just having them hear the message and understand how bad this can be.
Mm-hmm. And I agree with you on that part, Leslie. That to recognize that meth is a problem. Right now, my grant has been going 5.5 years at Sisseton, Wahpeton. But one of the things that our Tribal Human Services Board is concerned about is what they want to hear is, we want to hear or see statistics. We want to see data. So I think one of my greatest challenges is gathering all that data from, Indian Health Service, from the hospitals, from the local clinics, from child protection, from the law enforcement, from the tribal schools, from all of these, because the problem with methamphetamine in our communities is that everything is connected. And so one of the things, my greatest challenge is gathering that data and getting everybody on board to collecting that same data. So thank you for bringing that up, because that is, that is probably a main concern for most meth prevention coordinators. So, Lynn, you mentioned, was it Lynn? You mentioned being a meth prevention coordinator is a civilian position. That's what your position is?
Yes.
Lynn?
Yes.
So we often function as intermediary between the police and the community. When has this role really been valuable, and when has it really been a challenge? Acting as that, working as a civilian in a civilian position, perhaps.
I would say that it has been very valuable, as far as I believe that the community sees me as a liaison to the law enforcement department, so they're somewhat more willing to talk to me and to share a concern, whereas I don't think they're as likely to go talk to a police officer. So in that regard, it's extremely valuable that I represent what is happening in law enforcement and engage that person in a way that would be inclined to speak to us. I don't know that I think generally I am the person that validates their concern. I understand their concern because I've been there with a family member. And so what I try to do is try to find ways to connect them to resources like treatment or counseling or outpatient services in some way that perhaps stops the process of their family member being arrested.
Mm-hmm.
Does that make sense?
Go ahead.
I've had
Leslie.
similar experience as Lynn, where people will come and say after a presentation, or they'll just come to my office or something, and they'll talk to me more about things more than they would a police officer, and because that's one of the things when I go into anywhere in the community, I tell everybody I'm not an officer. I'm an employee of the police department, but I'm not a law enforcement officer. And I think that kind of changes the dynamic a little bit, and so they're a little bit more willing to share something. And
I agree.
I was just going to say in the Native community, it's a different dynamic because there's a no snitching kind of unspoken rule. And so if there can be an avenue for people to approach law enforcement with the concern of getting this person help instead of getting them arrested, that's a very important step in Indian country.
I agree. Lynn, I think you hit it right on the mark. That's how it is. I've noticed that too. When I first started this job 5 years ago, my office was in the police department. I sat there for a few months, nothing, staring at my phone. And then it was after that, I'm like, well, people don't want to come in here and talk to me. I need to get out into the community. So we moved my office away from the tribal law enforcement into our Health and Human Services building. And, gaining that respect from community members that trust that, they can tell you information. I mean, like once I was frying bread at a community event and somebody comes up and says, hey, I know you work with meth, so-and-so is doing it. So creating that trust with our community members, you both of you are right, it is extremely important. And it's probably one of the biggest part of our job, actually. So we'll start with Lynn again. How has working with the tribal police enhanced your position as a meth prevention coordinator in your community? As we lead over into that discussion about being out in the community, at the grocery store, at the gas station, do you get that same thing where people will just automatically come up to you and give you information about who's using meth, maybe who's selling it, or their concerns?
Yes, absolutely. I think also working in this environment has given me a much better understanding of the dangers the police officers face on a daily basis. And I think it's important for us to understand that dynamic, but at the same time to find a way to open up that dialogue in order to connect people. Because, obviously, like I said before, we want to get people help. We don't want to arrest people. That's not our desire. And so for me, it's been a learning experience, but most importantly, I feel that my focus and my goal is to assist people that are using methamphetamine and their families to protect their safety.
Cool. Thank you, Lynn. How about you, Leslie? What are your comments on that?
Again, it's really similar to Lynn's, making sure that our community is aware of, the dangers and whatnot. And then also in working with the police department, I myself, I have more access to our stats or to the evidence, because a lot of people say, well, what is if people don't know what meth looks like or what it smells like or anything, or the different types that can be used and where people hide them and stuff. I have access to that because if our officers pull that, off an individual, then I can at least go take pictures of those things, and that way I can show our community, this came out of out of somebody's car here on the reservation, and it kind of makes it more real for them. And then also with being able to, do things with our officers, it kind of changes the perception of law enforcement for, like, say, our little kids in our community. Most of the times, the most interaction some have with an officer is if they're coming to arrest somebody. And
right, yeah.
Here with us taking kids or taking officers to do different things with the kids and set up different activities with them, then they're actually seeing, hey, this guy's all right, and so they're nicer to them, and not just an officer giving them a sticker every now and then. It's something for them to be doing and interacting with them.
I agree with you, Leslie. Just to be able to have a young person shake the hand of an officer, and have you ever noticed they always look right at their gun or right at their taser or right at their, but to just see that they're just a person, they're just a regular person that lives in the community.
Yep.
Well, thank you. And, that brings us to an important part of the conversation again, is that helping, we want to help our meth users in the community. I mean, that's kind of been my thing too, but what I'm finding out now is it's extremely hard to help a meth user to get off of this drug because it's so highly addictive. And I'm seeing now in our community where parents are doing what they can, but the meth user is coming back, and this is one woman, her son. She'll bring him in, he'll get off of it for a month or two, he'll go back, he'll start stealing from her house again, taking her car, being gone for days. Finally, it came to the point where he got very violent and started to threaten her, beat up her husband, all these things. So she told the judge, she went to court, she threw him in jail. She said, son, if you don't go to treatment, I'll give you two options. You go to treatment, or I'm going to sign a restraining order on you. The son said, I'm not going to treatment. Because it causes such depression, and they want more of the drug, and it's just a vicious cycle. So she had to sign a restraining order against him to keep him away from the family. And I'm seeing that more and more in our communities, in our families. And one of the questions that's come up is, how do we engage our communities? How do we engage our families? How do we engage our communities, and how do we empower our families to, want to get help when sometimes it just seems so, I don't want to say hopeless, but it seems it's very difficult, because we always know working with methamphetamine addicts, there's always hope. We can't ever give up. Like Leslie said, we always have hope. So, Lynn, maybe you can shed some insight onto that part.
I can totally identify with the scenario you just described, and I see it over and over again in families, even my own family. And I think that one of the things that we identified is that we have to talk about codependency and what that looks like, and we have to do training events and educate the community on ways, we have to learn to say no to a meth addict, and there has to be consequences. If you do not want to go to treatment, then you do not have a place to live. And sometimes that's the process that saves the person from death. So in our cases, we came up with two things. How do we intervene early before they get arrested, and how do we teach families about codependency?
Right, exactly. How about you, Lynn? What are your comments, or Leslie, I'm sorry, on that question? Maybe how do we engage community, or what's your advice on how to? What advice would we give to parents or relatives who are dealing with a meth addict in their family? Leslie?
Geez, Lynn and I must be, total the same type of workers.
Exactly, and that's exactly.
Because
that's great.
It's just the same way what she said is, we have to get out and first educate people as to what it is, and then the different ways to try to help them. We do have some different systems here within our own tribal court system, and we actually even have our own a tribally ran chemical dependency program here on the reservation. But a lot of times for meth users, it's almost a whole different kind of scenario for them, because if they go to treatment and, you know, they're not taking full advantage of it, then it's not going to work, you know.
Yes, and
so
and that's exactly what I tell people. That's one of my, you know, and I know we had a comment from Celeste that said the national recidivism rate for methamphetamine users is 94%. So that means that only 6% of users get clean and stay clean. And you know, I'm sure that statistic that we're seeing, I don't exactly know the numbers, but I'm sure that it's as probably as high, you know, for those in our community. From, you know, I've collected names since I started. I've collected names that people have given me. I'm up to 234 names since January of 2008. So, you know, it is a problem, and trying to engage our community towards positive change. So, Lynn, maybe you could share with us what are some of your most successful projects when engaging the community? Just very briefly, like you mentioned some of the projects, but what was like your most successful that you just felt like, wow, that made an impact?
Before I do that, can I ask you a question?
Sure. Yes.
Going back to the treatment scenario for any addict who needs help, do you have a problem with aftercare? Because I've noticed in our area that people are, you know, if you come right back to the reservation or your home, that it doesn't really work very well. And so I'm wondering if you or Leslie have any other, do you have sober houses on your reservations or any other ways to address the aftercare, after treatment care?
In Sisseton, we do have rehab. We have a rehab home that they can go to, but I agree. Aftercare is a big issue, even in our community. Not enough time, funds, or devotion is dedicated to aftercare. You know, they'll go to a meeting. There's different. We have NAAA, all these Al-Anon. We have all these support groups, but I'm thinking there's got to be something else. You know, there's got to be something else just when they get out, because methamphetamine, it's got to be a family treatment process, because like with any addiction, alcohol, I mean, the whole family really does have to get involved, and those conversations have to be started about, you know, what can I do to help you? Or, I mean, for a meth addict, you in recovery, any little thing. I've had meth addicts come into my those in recovery come into my office, and I've got pictures on the wall about how meth looks and all this education all over my walls, and they'll come in and get real shaky, and they'll be like, one of them said, I cannot even be in here because these are triggers for me, you know.
Right.
So I'm sure you both see the same.
Yes. Okay, well, going back to your original question on what I consider to be the most successful projects for the Kalispell tribe, I would say that in the last 2 years, there's probably been two things that come to mind. The first one was very law enforcement focused, and it was called the Red Light Raid that took place at the casino resort location. And the other was the fact that we were able to start our X-Watch coalition with the doctors, dentists, community members in the community at the North Reservation. And I can go into depth about those if you would like me to, but those two things are the things that are highlighted for our tribe.
And that's fine. That's good. Leslie, how about you? What are one of your most successful projects that you've ever done?
Well, one of the most successful ones is being shown here on the slides. We had, it was, everybody calls it a water tower. Some people call it a water treatment building, but it definitely it does some functions with the community water supply. But it was basically right next door to our Fort Hall Elementary School, and it was getting tagged up by gang members. It was getting just, you know, all kinds of, you know, swear words and, you know, just other things. And our little kids had to sit there and go to school every day and look at that every day. So my program with the police department and the fire department, along with the school, we said, you know, we want to clean it up. So we talked to the school. We had the 4th and 5th graders come out. Fire department came and barbecued up some hamburgers and hot dogs, and we invited all the parents. We put it out in the paper and put it out, everywhere we could. And we even had some community members, some local guys that, wanted to start up a tattoo shop. They came and with their rakes and lawnmowers and everything, and we repainted the building. And the last picture that's on our slides from that, where the building's all nice and, pretty looking, it's still that way today, and those pictures were from 2010.
Wow,
So,
that's good. That sounds like a really good project, because the bottom line is that in our community we have to be aware that these things that are going on, sometimes they go on for so long they become normal. And, the work that both of you are doing, Lynn and Leslie, that just shows us, it tells us that we can create a new normal, and we need all to be networking with all these different programs in order to do that. But I have another question from a panelist, and it's a very good question. It says, why should a police department consider including a meth coordinator position when they apply for funding? Lynn, can you give us some insight into that?
Well, in my opinion, I would say I think it's really important, because I think that tribal communities are more inclined to want to intervene before someone is arrested. And in my community, I think it's also, in any community, it's important that there has to be a way to, or a process perhaps available to people. I know that when my family member was in trouble, I had no idea who to contact. I didn't want to call the police, but it's the only thing I could do. And I actually asked them to arrest this person. And then I was told, well, we can't just do that. Well, and now I understand that much better. But if there was a place for me to go, I think it would have been much easier on me as a family member and easier on the person who was suffering. So meth coordinators in police departments are very important, in my opinion.
Okay, thank you for that. How about you, Leslie? What do you think about that question?
I feel that a meth coordinator is really important in a police department, mainly because we're, just kind of pointing on some of the few things that we've talked about, is we're the liaison between them, the officers and the community, because, most of the time, I know for our officers here, we have two patrol officers on shift during the daytime. We do have our captain and our chief and our criminal investigators, but mainly people only see the two, and they can get so hectic and so busy they can't take the time to go and spend 2 hours with the kids at the recreation, or they can't take the 20 minutes it's going to take to go and read to a school, to one of the classes in the schools. It's
right.
To us, to me, my role is to be able to get information out there, get our officers involved as much as they can be, based on their time, and then also to, just help give people that kind of like little filter that some do want between the police department and whatever else is going on, whatever they feel they need to tell somebody.
Right, and that's exactly what my office does too. But I'm going to be honest with you, and I have contemplated this question at one point in my grant. I mean, I had a 2-year grant for $450,000. Turned it into 4 years, saved a little money here and there. But one of my frustrations recently, within the past year, is, I told myself, okay, you've been doing this and doing this. How are you going to? I felt it was my job to get the meth addicts off of the streets and to get them help and all this. But it's very frustrating, because when you work with the police departments, they have to build up cases. They have to gather all their evidence, all their data. They have to watch everything that goes on and connect all the dots. So I have contemplated at one time, and I told my boss, I said, why don't we put me on layoff and take the rest of the money for my position, and let's hire a police officer. 2 police officers. If we let's just put all the money into hiring officers. But then again, it's hard to get in my community. It's hard to get certified police officers. And we talked about it for a while, and it kind of came out to exactly what both of you are saying. Is our positions, any meth prevention coordinator position, is that liaison. It's between the community and the tribal police. A community member would rather talk to me than a tribal police about their problem, because the tribal police, their mindset is that, okay, you tell me a problem, I got to get help for it. And for us as coordinators, we kind of network. We're networking with all human services, child protection, ALC treatment program. We can find them resources that way without it going boom right to that level of police. But I think that was very good information for you. And another question is, does a meth coordinator position require any specialized training? Lynn, do you have a few words on that question?
I don't think so. I think more than anything, it requires a passion. In my case, because of my experience with my family member, I have a passion to see people be returned and restored to their well-being state. And I because I had at one time worked for a sheriff's department, I believed that that was missing in that department, and so I see it as critically important.
How about you, Lynn? Oh, I'm sorry, Leslie. I got two L's going on here.
Yeah.
Leslie.
Well, the way that my job description is written is there's got to be either some sort of certification or job experience or degree relating to anything with law enforcement. I currently hold a Bachelor's of Science degree from Idaho State University, but in all reality, if somebody just came in and had experience working with, any other federal grant and was willing to learn all about meth, because I didn't go to college to learn, for meth. I didn't go to college to learn about meth. It's just something that, as soon as I got hired, I started learning everything about meth and addictions and how the police work, and, and started to kind of tie it all together. So,
exactly.
I think almost anybody could do it, like Lynn said, with a passion. Somebody's got to be, whoever is a meth coordinator, they need to be able to, not be afraid to go into the community and not be afraid to send a message to the community that they're going to hear.
Yeah, exactly. And thank you both for that answer, because I agree about the passion part of it. And with anything we do in life, we want to have a passion for what we do and really believe in it. But Lynn, you had a family member affected. Has your family member been, is he or she in recovery at this point now?
I'm happy to say yes, but it's been a long journey. It's been multiple episodes of treatment. Currently, the person is 5 months sober in a 1-year inpatient treatment facility.
Good. I'm glad to hear that news. So
yeah.
That's good. Every day, just like any addiction, we go day by day. But Lynn, maybe we could start with you again. Do you work closely with your tribal council and the human resources department in your tribe in the prevention of tribal employees? And if so, what does that look like?
I would not say that I work closely with the council or the HR department. I would say that our executive director kind of does that work. But I will say that we've done multiple things because they have and are willing to work with us. We've done training in the casino for how to identify meth labs should they see something in a room. We've done all-employee training or employee training to help people understand what drugs look like should they run across them. And we have the Kalispell tribe is, all employees of the Kalispell tribe are mandatory reporters in terms of drug-endangered children, which is very proactive for them. And there is an anti-drug alcohol policy that is written out. So I would say that this tribe is very proactive in that regard.
Okay. How about you, Leslie?
Well, not. I've gone to several different departments, and I've done meth awareness for, and I tailor it for each department, for, like our local housing department. I did it for them, and I showed them more of what signs to look for and what signs to, to report, and, different ways on, ideas on how you can, get, if somebody's smoking meth in a home, how do you clean that? What precautions do you need to take, and things like that. And then when I went in and did it for the casino employees, I told them more of the signs to be what to look for in a meth user.
Yes,
and stuff like
I
that.
agree. Yeah. There is a lot of there's a lot of work that are duties that this work entails, and I'm sure both of you wear a lot of hats as well as I do. And working with, but I'm going to say that working with our tribal council for me is very vital, and also the human resource department, because I've noticed that. Since working in this field, our tribe has developed or implemented a zero tolerance for drugs that has gone into effect. So, have any of you, Lynn, or Leslie, do you have that kind of zero drug tolerance policy? That's that your whole council just says, you know what, we're not going to stand for this anymore. Have they taken that stand, Lynn?
Yes, the Kalispel tribe has a no alcohol. Is it considered a no alcohol zone and a no drug zone on the reservation?
That's good. How about you, Leslie?
Yeah. The Fort Hall Indian Reservation has been a dry reservation for the past, I would say, about 40 years. We do have our problems with alcohol and drug abuse here, but as far as the tribal council and with our tribal departments, we do have a substance abuse policy. I don't think it's quite to a zero tolerance yet, but there's different levels, and then, say if somebody does get caught violating the policy, then there's different avenues to take. There's our EAP program. There's, like I said, we have a on-reservation treatment program here. So that's why I say I don't think it's at a zero tolerance yet. It's just because we have other avenues to help somebody. And just recently, our tribal council, within the past couple of years, they've made our tribal business center a non-smoking building. So if people want to smoke, they have to go outside of the building to smoke, and not be inside and smoke.
Wow,
so,
they just now did that for one of your buildings?
And it was it's the main tribal business center building.
And they were still allowed to smoke in there, huh?
Yes, they still were.
Yeah, that's crazy. I think the last tribal building I ever saw anybody smoking in, it's been at least 20 years now, I'm thinking.
Oh wow. No.
It's been a while.
No, we've always people have always smoked in there, because it's also a gathering place for a lot of elders too.
Yeah.
We do have our elderly nutrition program in there, and just different things, and so they finally made it just a couple of years ago. So they're and then also our tribal council implemented an exercise program, to where if you wanted to go exercise, you could, up to 3 days a week, you could get a half an hour off your work schedule to go and exercise.
Well, that's good. And it shows that they're implementing, that they're moving toward progress, a change. And change, we all know, is never easy, but it's good that these things are taking place, because we know that we're moving towards a healthy a wellness towards our communities, which I think is very important, even to the meth addict. When somebody comes in here with a meth addiction, and they say, you know what, Crystal, I'm trying to get off meth, what can I do? I don't want to go to treatment. What else can I do? And so then I help them develop a plan. One of the main things is, of course, the spirituality of the individual, whatever that may be, but to work towards that. But also to work, I send them over to our tribal fitness center, and I'm like, go over there and work out. you're going to need that energy. You got to build up your endorphins in your brain. You got to start bringing that back in a healthy way. So go over and get a good workout, work up a good sweat. That way, it's going to help you sleep. You're going to feel better about yourself, and those types of things. So we are coming to the. We have a few minutes. I know we got started late, but a few things that I want to cover first next is that in many tribal communities, drug activity and tribal housing sites are a concern. So I want to get to this topic because they really are drug activity in all of our housing sites. Does your program work with your local housing authority to combat meth? Lynn, if so, please share some of these activities and our projects with us.
Yes, I'd be happy to. Our housing department recently updated their housing policy, and in that process, they included some drug testing of homes to help ensure the health and safety of the tenants. During that process, they identified 30% of the rental homes on the tribal reservation tested positive for methamphetamine. And so what has happened now is the housing department has hired a contractor to go in and to test residue levels in order to make sure that their people are safe. And if they do test positive above a 0.1 residue, then there's an emergency eviction notice that goes out. There's a grievance process that can be followed, and then the contamination process begins. This is the housing department's policy. The way that we assisted them was to help them put information out into the community that explains why it's important to do this because of the dangers associated to methamphetamine. I think talking to Leslie's policy is probably a little bit more advanced than ours is, and that she owns that scanner that we want to buy. So that's where the
that's Crystal scanner.
Oh, that's Crystal.
Yeah,
okay.
That's Crystal scanner.
Okay.
We're envious.
How about you, Leslie? You work with your housing?
Just a little bit. We've gone over there and done some different types of trainings with them, with their employees, but and just with them, going through some legal battles with some of their tenants, whether they're homeowners or renters, over, alcohol use or drug use, especially methamphetamine use. They're actually starting to become a little more proactive. These weren't procedures that were already in place, and but they're actually starting to get more proactive. They're actually looking at either contracting with somebody to come in to do some of the testing in the houses, much like Lynn was talking about, or getting their own people certified to do it. And all that we've done is just provide them information and where to go with it. We really haven't gotten too involved in actually helping them trying to set their policies and procedures, but we let them know that we're here to assist them in any way that they need to.
That's good. And again, progress is being made. Every time we move forward, it's always a good, even if it's baby steps. But yes, so at the Sisseton, Wahpeton, Oyate, we do have the mobile trace scanner that we use. Our first grant we got in 2007, we put in, we didn't really, to be honest, we didn't really know. Okay, so it was in a grant, it was listed, we're going to buy this machine. And also in our grant, we were going to buy all of these home testing kits. We have over 550 homes. We were going to buy all these home testing kits, which you can use for one time. They range anywhere from $65 maybe to $100. So you can imagine what kind of money we would have spent on home testing kits if we would have purchased 550 of them. So we bought the mobile trace scanner first. We started testing, went into process of testing homes. Recently, within the past year, I've been collecting names from communities. I got 38 names from different people that said House 54, 69, 32. They're all using meth in those homes. You got to do something. So we got with law enforcement, tribal housing, and they said, okay, we'll start testing these 38 that you have concerns from community members. We went into the first 11 homes, and every single one of those tested positive for meth. So we're like, okay, housing says we got to step back because now what are we going to do? And, like the whole community went in an uproar over this. So from that situation developed a policy that housing now put into effect that says, okay, so just this morning I went and they called me in, I tested a home. When someone moves out, we test it. And this morning we found traces of cocaine and some amphetamines. So what will happen is the housing guys know that there were residue of drugs. They'll clean it up, and then when they get it all cleaned up, fixed up, painted up again, I'll go in there and retest it, and then it will be and they'll clean it until it tests clean. And then the new tenant, the occupant that's going to move in next after it's all done, will know that they're moving into a drug-free home. And they'll sign a lease, and then they'll say, okay, from this day forward now, you can't blame anybody else because if we know it's clean, it's tested. If we come back and spot test in 6 months or whenever, and there's any evidence of drug residue, you, the tenant, you're going to be held responsible. Your name is on the lease. You have to watch who comes in and out of your home and what activity is going on in here because we're watching now. So that's one of the great things about this machine is that it allows those conversations to begin. And it doesn't really pinpoint who the drug user is or anything like that because, like Lynn mentioned earlier, we're not in the business of sending people to prison. We are in the business of helping our community members to get well, to be healthy. So, this machine would helps us to do that. So I think maybe on another webinar, perhaps we might even just spend an hour speaking about this mobile trace scanner. And for us, it costs $40,000. But, it's been well worth it. We bought it, 5 years ago. We're still using it today. The guy, our salesman, has been great as far as bringing in training. He'll come in and train your staff. At housing, our staff maintenance have been trained. Our security guards in the housing authority, everybody knows. And even we take this machine. We went over to one of our tribal programs. They said we're suspecting this woman is using meth. She works here. Come and test our building, our office. So we go and we test the office. We find traces of methamphetamine. Our human resource officer says, okay, everybody, the police go over there. They shut the place down. Everybody is in there. It has to be drug tested. And then you find the culprit. So all of these things work together. There's so many things that we can do. But I think our time here is coming to an end. But I want to thank. I believe, that we've had a great conversation. I want to thank you, Lynn and Leslie, for all of the information that you've given and that you've shared in the work that you do. And I commend you for that work. And, just keep it up. Keep your, take care of yourselves, too, in the meantime, because I think meth prevention coordinators, we have to take care of ourselves because when we interact with addiction and all these problems that are associated with it, we have to take care of ourselves. So I guess I'll turn it back over to Heidi.
Thank you so much, Crystal and Lynn and Leslie. That was a wonderful discussion. That completes our time here today. Please take a moment to fill out the evaluation questions that are posted on the screen at the moment. We have this information. We use this information to improve the format, content, and design of future webinars. We really appreciate your candid feedback. For questions that are not answered during the presentation today, we will be sending out an email addressing those questions to all the participants. We would like to thank you, both our panelists and all of you who participated today on the call. To download previous webinars and handouts from this series, please visit www.methpedia.org. Thank you all.